My name is Dr Bob Ryder from Birmingham in the United Kingdom, and I'm presenting here data on the Duodenal-Jejunal bypass liner. These are my disclosures, and this is a picture of a Duodenal-Jejunal bypass liner, also known as EndoBarrier and more recently Reset, but because historically it's been most widely referred to as EndoBarrier, that's the term I'm going to use in this presentation. It's a 60 centimetre impermeable sleeve implanted with a simple endoscopy procedure into the first part of the small intestine, such that the food passes through it rather than that 60 centimetres of small intestine, and it mimics the bypass bit of the Roux-en-Y bariatric procedure. As over 3,000 EndoBarriers have been implanted worldwide as a treatment, in 2017, the Association of British Clinical Diabetologists set up a worldwide EndoBarrier registry to collect data on as many of these 3,000 patients as possible. And as of January 2024, data had been collected on 1,101 patients from 36 centres in 11 countries worldwide. And you can see here the baseline characteristics. In particular, I point out the very high BMI, over 40, but also draw your attention to the fact that only 84% of the patients had diabetes and that many of them were being treated for obesity only. During the year with EndoBarrier, they lost 13.6 kilograms. The mean hemoglobin A1C fell from 8.4% to 7.1%, and there was also a fall in blood pressure and cholesterol. I pointed out that not all the patients had diabetes, and even those with diabetes, many of them had good glycemic control. And so we looked at the fall in hemoglobin A1C according to the baseline hemoglobin A1C. And you can see here that the higher the hemoglobin A1C at baseline, the greater the fall, such that if the baseline hemoglobin A1C was over 11%, the fall was 3.8%. There were serious adverse events, and they're listed here, and the overall rate was 4.3%, and the majority of these, 2.4%, were gastrointestinal bleeds. But I draw your attention in particular to the 1.1% rate of liver abscess, which is noticeably different than the 3.5% found in the FDA pivotal study. And this suggests that that 3.5% was an outlier, as it doesn't reflect the worldwide experience, a much lower rate. There were less serious adverse events, and this is a typical such patient. You can see because of severe pain at 6 months, the device was removed and it was found that it had migrated. But nevertheless, as you can see, by that 6 months, she'd lost 43 pounds. It had a dramatic improvement in her hemoglobin A1C and the requirement for insulin. And 3 years later, you can see that the improvement was sustained. This gentleman here dropped his hemoglobin A1C into the normal range. He came off insulin and there was a weight loss of 56 pounds, and his improvement was sustained with time. This lady here not only had obesity and a requirement for 120 units daily of insulin, but she also had obstructive sleep apnea, requiring continuous positive airways pressure ventilation, or CPAP. And with the weight loss of 46 pounds from her EndoBarrier, the CPAP was no longer required, as well as the big improvement in her glycemic control and requirement for insulin. And with the passage of time, that improvement was sustained and she remained off CPAP. This lady here had improvements in her renal function, as well as a big improvement in her diabetes. And you can see that improvement was sustained. And so, in summary, the mean weight loss was 13.6 kilograms. The higher the hemoglobin A1C, the greater the fall, with a fall of 3.8% when the baseline was greater than 11%. The The serious adverse event rate was 4.3%, the majority of these being gastrointestinal bleeds, 2.4%. The early removal rate for hepatic abscess was 1.1%, noticeably less than the 3.5% found in the US pivotal study. And all the serious adverse event patients worldwide all made a full recovery, and most experienced considerable benefit despite the adverse event. And so these are our conclusions, that EndoBarrier therapy is associated with improvement in glycemic control, weight, blood pressure and cholesterol. These are likely to reduce the complications of diabetes, and this international data from the worldwide registry suggests that likely benefits of EndoBarrier outweigh the risks.